I appreciate everyone's who's here, although those who are not in the summer internship or new to the program do not feel obligated to stay. This is really, in the summer, we have these sessions mainly for our summer interns, but we invite everyone and they get a chance to hear about the work that people do and so forth. So that's what I am doing today, and but we invite everyone. So if those of you who want to listen in, you're more than welcome to do so. And then I've also tried to not take up the whole hour talking, so that there will be some time for question and answers. And again, anyone can feel free to ask questions, although the focus of this session, again, is on the summer interns and those who are otherwise new to the program and the department. And if some of you have been to our either open house or other kind of sessions, some of these slides may look familiar to you. So I'm going to go ahead and put myself in presentation mode. And I will warn people ahead of time that I am home alone today with my dog, so, who I hopefully gave something to do to keep him busy the next hour, but may need to switch to that activity if something happens. So anyways, I am Bill Hersh. You all probably know me or know of me. I see some of you are current students in the program, and it's great to see you all. And my purpose here is to give an overview of the field, the department, and educational programs. So I was going to do introductions, but that may actually be challenging. So maybe we'll skip that. Although when people do speak up, please introduce yourselves and of what program you're from. Feel free to post things in the chat, which I will get to when I finish my presentation. You're welcome to keep your video on. We encourage people to turn their audio off if you're not talking, just so there's no background noise. So mainly I'm going to focus on the second, the overview of the informatics field, the department, our educational programs, and then we'll open it up for any questions and answers about anything. So again, some of you have seen the slide, but I know that for the summer interns and maybe others who are new to the field, what is this field called informatics? I like this Venn diagram that shows it's the confluence of people, information, and technology applied in something related to health or healthcare or public health. I have a website that I was able to snag one of the new .health top level domains. So informatics.health, type it into your browser, you'll get me. And one point I always like to make is, it's more about data and information than it is about technology. Obviously, you can't do much with data and information without using technology, but really the focus is on the data and information and what we do with it to improve people's health and healthcare delivery. There are many sub areas of the overarching field, which we usually call biomedical informatics, or even the name I actually prefer, biomedical and health informatics. And then the different areas correspond to whether we're focused on the cell, on cellular processes, and that's bioinformatics, whether we're focused on people, which we most commonly call clinical informatics, and or whether we're focused on populations in public health informatics. And then within clinical or medical informatics, there's medical informatics, there's informatics devoted to different clinical fields, pathology, radiology, et cetera, and also consumer health informatics. And there are actually other probably the word informatics is used most in biomedicine, but there's a field of legal informatics, chemoinformatics. There's a field called museum informatics that focuses on informatics issues for museums. Yeah, and as you know, museums spend a lot of time cataloging artifacts and so forth. And then there's these kind of overarching areas, imaging informatics, research informatics, hang on, let me stop for 1 second here. I'm gonna let my dog out. There you go. Okay, that should hopefully take care of this for a while. And research informatics, which there is applied to different areas of research, sometimes called like clinical research informatics, which is focused around all of the clinical and translational research. So there's a lot happening in the world that informatics is connected to. There are many important roles that it plays, whether it's electronic health records, so tracking what we do in healthcare, maybe even using that data to predict things that patients might need, how we can deliver their care better, improve the quality and safety. The whole area of data science that is burgeoning, machine learning, artificial intelligence, really in its early days in terms of the actual contributions. Most physicians actually have very little to do these days with clinical, with machine learning in their day-to-day work. That will obviously change in the future. Precision medicine, a term you may have heard of, bringing more precise diagnosis and treatment to patients, yeah, especially all of the omics, genomics, proteomics, the microbiome, et cetera. And then the whole kind of patient connected side, personal health records. So personal health record being what patients, how patients interact with their electronic health record. Probably many of you get your care at places that use Epic, so you may use MyChart. That's probably the most widely used personal health record. So someone, if someone can, there's noise in the background, can mute your line. Thank you. But other things that patients do, wearable devices, things like that. And of course, there's the important role of informatics and COVID-19. COVID-19 has certainly exposed problems with our healthcare system. It's certainly exposed how our data and information systems are not as good as they could be. And it's also exposed other fault lines in society, systemic racism, other inequities that we have in our society. But this then provides opportunities for us. And in fact, there's actually a big push by the government to improve our public health reporting systems. There's even going to be funding for public health informatics workforce development to help build those information systems and get us out of the current pandemic and perhaps guide us, put us in a better position when the next one happens. And then also reforming healthcare and other aspects of our larger society that benefit the common good. We knew actually that there were career opportunities well before the pandemic. As some of you know, this has been an interest of mine. How big is the healthcare IT workforce? I and some others published some research in 2018 showing that as the scope of healthcare IT continues to grow, as healthcare organizations take on more informatics related tasks, that there could be anywhere from 19,000 to 153,000 more jobs in the United States. And of course, back then we weren't really thinking about things like telehealth and so forth. And in terms of opportunities in informatics, in terms of sheer numbers, the largest quantity of opportunity is in the healthcare system, but there are plenty of other important opportunities, and many alumni of our program work at research institutes, in industry, in government, and so forth. This is a report that was published in 2018, The Future of Jobs. It looked at jobs whose jobs that were emerging and jobs that were declining. And you can see if you look down under the list of emerging jobs, there's a lot of things related to biomedical informatics, data analysts, data science, AI, machine learning, IT, big data. And then if you look at the jobs that were decreasing, data entry clerks, although actually we still need good data to be entered, but other things that were decreasing. And I don't know how much the pandemic has impacted this, because we know that there are plenty of industries now that are looking to hire people. But anyways, this was an interesting report. So most of you probably know that our program is housed in our department, the Department of Medical Informatics and Clinical Epidemiology, or DMICE, as our acronym is pronounced. We are an academic department in the School of Medicine at OHSU. So as I'm chair of the department, my boss is the dean of the School of Medicine. And like many other departments, our mission is to provide leadership, discovery, and dissemination of knowledge through research, education, and service. We happen to apply it in these two fields. Other departments apply it in other fields. I'm mostly going to focus on informatics today, but we do have another part of DMICE, the clinical epidemiology side of the department, that focuses in areas like evidence-based medicine, systematic reviews, meta-analysis, things like that. And of course, we have a large department with about 100 employees. The rest of the department leadership is listed here, and some of these individuals are involved in the informatics education program, others are not. But Shannon McWeeny heads the bioinformatics, and actually that should say computational biomedicine, which we changed to a few years ago. David Dorr is very focused on research and clinical research informatics. Karen Eden does faculty development. She also has a leadership role in the PhD program. And Cindy Morris, who's more on the clinical epi side, but she also directs a program that some of you may have heard of at Portland State called Build Exito, that is increasingly interdigitated with our program. So if you went to, say, US News and World Report, and just like you can look up the best medical school, the best law school, the best accounting school, there are no rankings for biomedical informatics, which is actually probably a good thing. But that said, how do you know whether a program is a national leader? Well, you can look at the kinds of accomplishments that the program has. So for example, we are one of 16 programs that are funded through the National Library of Medicine Training Grant for PhD and postdoc students, which is a distinguished group of informatics programs around the country that are leaders in education and research. When there was funding from the Office of the National Coordinator for Health IT for Workforce Development, we were one of 9 programs funded. There have been international funding efforts, like through the NIH Fogarty Center. We were funded under that program. We are a consistent recipient of research funding. Last year, our research funding was something on the order of $15 million in research grants. Our faculty are appointed to national and even sometimes international leadership roles, and we have publications in high-profile journals, and all of the kind of things that academic and research leaders do. And we also have a large and distinguished alumni. I'll actually talk about them in a moment. But we have over 800 alumni dating back to the late 1990s. And our clinical epidemiology program on the other side of the department, even though they don't do they don't do as much education as we do in informatics, but they're very successful and well known around the world. For example, they've been involved in some of the living systematic reviews that have been done around COVID related topics on drugs, the efficacy of face masks and things like that. So our what brings a significant number, large number of people to our department is our graduate program, our educational program, and it really is, I think, for us a crown jewel. Many of us on the faculty and staff are very passionate about our program, and really aiming to achieve that goal of training future professionals, researchers, leaders in the field. So we have two different majors in our program I'll talk about in a moment. And like most informatics programs, all programs are at the graduate level, so require a bachelor's degree to enter. I think over time we may see more undergraduate programs. Just checking on my dog if you're looking at my screen. And then we have a diverse student body in terms of their backgrounds and where they come from, careers and so forth, but typically fall into one of two categories. Some people come in because they're still in their primary education, which may include graduate school. These students are more likely to be full-time, quote unquote, on campus. Everyone is virtual now, but when we do in the future come back to campus, we'll have more students around on campus. But we also have this cadre of what we sometimes think of as career-changing students. They are individuals who are more likely to be changing their careers. A good number of them are from healthcare professions, so physicians, nurses, pharmacists, others, although not exclusively. We have people from many different backgrounds, but are typically wanting to move their career, change their career into informatics, and they tend to be part-time. They tend to be enrolled in our online program. And they, of course, we all interact as one happy family. Since a lot of our courses, even before the pandemic, were online, they interact with each other, which we think adds a lot of richness to the program. So our program, we used to call them tracks. Our provost insisted that we change them to majors. So in our overall biomedical informatics program, you can major in either health and clinical informatics, which we abbreviate HCIN, or bioinformatics and computational biomedicine, which we abbreviate BCB. The original program, actually back when it was formed, was actually called medical informatics, but we now call it HCIN. It was really focused on health and healthcare, and to a lesser extent public health and clinical research. It's focused really on kind of the core of informatics and applied data analytics. The BCB program started with a very kind of bioinformatics focus, so focus on the different omics, genomics, proteomics, the microbiome, but has really expanded, including clinical data. And the BCB program focuses more deeply on the data science and machine learning. And some of our HCIN students opt to pursue the machine learning and the BCB major. That requires a very strong mathematical background that not everyone may have, especially people who have been trained as healthcare professionals. I mentioned the department leadership, so the program leadership is somewhat similar. I serve as overall director of the program and oversee the HCIN major, along with actually Karen Eden. Actually Nicole Weisskopf has now taken a role in this position. She should be added to this slide. And then Shannon and Eilish Boudreau overseeing the BCB program. And then really critical, just as important, if not more important than the leadership, is the faculty who teach courses, advise students, mentor them on projects and so forth. And those of you who are summer interns are already paired up with a faculty member, and most of the other students in the program get paired up as well. So our program is, our informatics graduate program is one of the oldest and largest in the country, in the world maybe. We're not the oldest. There have been some that have been around longer. We were a fairly early adopter of online learning. I was going to say machine learning there. Online learning. We like to keep this a map of where our online students live. And as you can see, they're maybe a little bit clustered in the Pacific Northwest, but all over the country. And as I mentioned before, our numbers, we have awarded 872 degrees and certificates to 782 people. Some have more than one. And you see here the numbers. The HCIN program is larger and has been around longer. It also has the graduate certificate program that the BCB program does not. We have 782 alumni. We keep in touch with them. I actually see a few of them are on this conference. We're very proud of all that they accomplish in academia, in operational settings, in hospitals and research institutes and so forth. We do try to keep in touch with them and engage with them. And so as you can see, we've awarded a few hundred master's degrees, 31 PhDs, and a large number of certificates. Since the internet knows no boundaries, our program knows no boundaries, although sometimes we run into political challenges when individuals from some countries want to enroll. I would love to see that all go away, but I'm not going to change that. But we have students take our courses online from all the countries listed here: Singapore, Thailand, Argentina. Those are probably the three main groups that countries that we've engaged with, and then some of the other ones listed here. Pretty much every continent, maybe with the exception of Antarctica. And then at the bottom of the slide, I say, well, you know, you're an old program, you're getting old, but despite our age, we really focus on continually improving the program and updating it. So for example, if you go back and look at our curriculum from 5 to 7 years ago, you might see, well, maybe there was the beginnings of machine learning. But you know, we keep up with what is really important for the field. So as a graduate program, we award the common graduate degrees. So the Doctor of Philosophy or PhD, which is mainly for people who want to pursue research or academia, although sometimes other careers. We actually have two flavors of our master's degree, and these have gone by different names over the years. So these are the current names of our programs. We basically say Master of Science with thesis and Master of Science non-thesis. And this reflects that master's degrees in the world have really kind of bifurcated into research masters and professional masters. And our two master's options reflect that. So research masters, sometimes they're pursued by someone who has a doctoral degree in another field, doesn't really need to get another doctoral degree, but they still want to do research. So they sometimes people use the term postdoc masters, or the professional masters, and certainly there's been growth in all fields in professional master's degrees. And then our graduate certificate, which we started when we started teaching our courses online, because we didn't actually think that back around when we started teaching online in 1999, that people would want to get a master's degree. So we started this thing called the graduate certificate, which other informatics programs now offer. But we actually found that there were enough people who did want to get our master's degree. So we, in the early 2000s, moved our entire master's degree program online, and it remains. So this is a kind of a matrix of the two majors and the different degree options. So even though there are more online than on-campus students in our program, they are all either in the graduate certificate or the master's non-thesis. People can sometimes do a thesis online if they wish, and we have a way to accommodate that. All of the PhD program, the BCB program are on campus. However, for the last year and 3 or 4 months, everything's been virtual. And so everything has moved online. I think our hope, our plan is that the on-campus programs, when OHSU fully opens up, which we're planning for starting with the fall quarter in September, we will resume having students on campus. Although, like many industries, education will probably have a kind of mixed model of making more use of online and virtual activities when the pandemic is over. So there's a planning process going on right now with at OHSU, like with many universities, to reopen by the fall. And for those of you who live in Oregon, know the state of Oregon has, as of yesterday, has reopened, and hopefully things will continue to return toward normal in Oregon and other states. A little bit about the curriculum in all of our programs. So each major and each degree have the curriculum organized into domains. So for health and clinical informatics, the domains are like healthcare, computer science, organizational behavior and management, and a couple others. And each of those domains has required courses. These other ones called individual competency, where you choose from a menu, and then electives. And then the degree programs are basically built around something we call the knowledge base, which is for each of the two majors, that kind of core set of courses in the different domains make up the knowledge base. And then if you do the master's with thesis, you do a master's thesis. If you do the master's non-thesis, you do a capstone, which can also be an internship. It's a little bit less intense and has fewer credits than the thesis. And then if you're in the PhD, you do the knowledge base, you do additional advanced work, including advanced coursework, and then ultimately your dissertation. Another way to look at our program is a kind of stacked or building block approach. So there's the graduate certificate, again, which is only for HCIN. There are, and then that is in turn a subset of the master's programs. And then, so then you have the knowledge base and the master's programs, and then that is in turn a subset of the PhD. So I've mentioned before that informatics career pathways have different inputs and outputs, and oftentimes what you do as an output will be dependent on what you came in with. And so a classic example of this is the job of Chief Medical Information Officer, which is typically a physician or other healthcare professional. So you probably would not be a computer scientist or a librarian or some other occupation, and then go through our program and be a CMIO. But as you can see on the left, the different, we have healthcare professionals who come in, natural and life sciences, We have a fair number of computer science and related fields, health information management, and a whole smattering of other backgrounds of people, business, library and information science, and others. Then they all get mixed in graduate education. They stop and get their education, and then they go out and take different jobs. And usually the jobs that they take are dependent both on their studies, but also what they came in with. So there's no real like single career pathway. It's not like medicine or law where, you know, I guess people come into medical school with different backgrounds, but you pretty much emerge, you know, with an MD degree, you know, and I suppose there's some diversity in the kinds of different things that graduates of MD programs do. Some of them become directors of informatics programs. But anyways, the point of this slide is just that there's a lot of variation both in the inputs and the outputs from the graduate program. Another way to look at what informatics does is by what is the workforce who say they work in informatics does. So our professional association, the American Medical Informatics Association, a few years ago undertook a workforce analysis, and they focused on two distinct audiences. The bottom one, the clinical informatics subspecialty, though that is a subspecialty for physicians. Physicians, you know, again, are an important group in the program and the field, but by no means all, but not even half. But there is a formal pathway for physicians to now get board certified in clinical informatics. So there has been a fair amount of work kind of focusing on physicians in informatics. So that's the bottom analysis. The upper analysis is basically the larger health informatics field. But the irony of this analysis was they were done by two separate processes and almost came up with identical tasks. So there are some papers that have been written. They're available on the AMIA website. I can, if any, they're actually open access, so you don't need to go through library to get them. But interestingly enough, there are 5 domains that contribute to the work that informatics professionals do. So there's the foundational knowledge of knowing about if you work in healthcare, about healthcare, if you work in public health, knowing about public health, knowing some of the foundational aspects of the informatics field. But then the second domain is the kind of decision-making, decision support, oftentimes in the healthcare context that's used to improve care delivery and outcomes. But that's an important part about informatics. Obviously, there's the information systems and all the issues related to their organization, their security, how their data is organized and things like that. So either health information systems or enterprise information systems. A fourth domain is around data governance, data analytics, data science. And in an analysis that was done of physicians back in 2009, led by Reed Gardner and colleagues, the data one was not explicitly called out. But since that time, data has become so central to healthcare and biomedical informatics that it has its own domain now. And then the fifth domain is leadership, professionalism, what sometimes people call the soft skills, although for many of us, the soft skills are really hard. But they're so important, as anyone who works in a hospital knows. Sometimes the technology is the easy part, you know, just getting the system running, getting the network up and running, and then, but getting the system so that it serves people, so that there's leadership, so that the systems are used to their best extent is really important. So this helps us understand the work of informatics professionals. Some of you may ask, however, since one of the hot topics in the last few years has been data science. So where does data science fit in? Some colleagues of mine wrote this paper, and the lead author is Philip Payne. It was published in the journal Jamia Open. They tried to distinguish, what distinguishes data science from informatics. And I actually think this figure, which maybe looks kind of busy if you're seeing it for the first time, captures it well. But if we start at the very top at 12 o'clock, all of the world that we deal with in informatics and probably everything else is either biological, social, technological. So healthcare, personal health, all those things are part of that. And all of those processes, especially in this day and age of information technology, generate data. In healthcare, we generate data about patients for individuals. We generate, they may generate data about themselves, wearables, social media. There may be other sources of data, public health data. Another important source of data is related to social determinants of health. And so from that data, we want to glean knowledge so we can make decisions and help individuals either have better health care outcomes or better health outcomes, better health. Payne and colleagues in this diagram call that the afferent process. We go from the world to knowledge. And this is where data science is critical. Although informatics does this kind of work as well, as we like to remind people. We were doing it before there was a term called data science. But the world doesn't stop at analyzing the data. We want to be able, we actually need ways to use that data to implement in actual systems, whether it's healthcare systems or healthcare information systems. And we want those systems to be usable. We want users of those systems to be able to take that knowledge and actually apply it to the real world. And that's the efferent cycle. And so that's where data feeds back to the biological, social, and technological processes. And this is almost exclusively the purview of informatics. I mean, there's obviously overlap here, but and the core skills you see are different. So evaluation, evaluating systems, implementation science, organizational theory, human-computer interaction, workflow, a huge issue related to electronic health records for clinicians. So these are kind of what distinguish data science and informatics. The two fields overlap and are synergistic, and maybe are almost really one and the same. So that's all I wanted to say about in our talk today. I did want to leave some time for questions and comments. We'll make these slides available. Many of you know our presence on the online. We have a YouTube channel where all of these talks, including this one, are posted. We have a website for the department. We have a blog for the department that anyone is welcome to contribute to. We have a presence on social media. We have a Twitter account that we try to use to publicize things about the program, a LinkedIn group, and a Facebook group. So I also have a presence on the web, on the internet, most of you know, and if anyone has any questions, they can follow up with me. So I am going to stop sharing at this point, and I am happy to answer any questions. I see that there's a few comments, including one from a graduate of our program, Michelle Bobo, who's been working on David Doerr's team. I actually didn't know that. It's good to hear. and so interested in learning more about the department. I can say that our research, our Thursday conferences, which don't always take place Thursdays, sometimes we might have them at a different time if someone can't speak at the usual time, or at the end of an academic term where a fair number of people are defending theses and dissertations and so forth. We have them at different times. If you get the notification about the conference in the if you're on one of our email lists, so we have an email list for faculty, we have an email list for students, we have an email list for our fellows, we have an email list for our alumni. Although Lynn Schwabe also keeps a separate list of people who just want to be notified about the conferences. You're always welcome. We used to stream them in the days before the pandemic. So when we would have them in the BIC Theater, which is still there, it's very empty these days. And but maybe someday we'll go back to being there. We used to serve pizza, which is always a draw. And maybe someday we'll go back to that, but that's all to be determined. Any other questions or comments from anyone about the field? Any changes or evolutions within the department you foresee in the next 2 to 4 years? That's a great question. I don't know that the department will change. I'm sure it will. I mean, new opportunities pop up. I think the good news is that the department is pretty well established in the School of Medicine. Actually, I have no imminent plans to retire, but at some point I may. Maybe when I'm kicked out. There could be leadership changes. There could be other changes. But I think one good thing about the department is that we've become pretty well established. People recognize the contributions that informatics and clinical epidemiology play in medicine and healthcare. We've been fiscally responsible with our budgets and so forth, so we're not going to be thrown out for that reason. I think I don't know of any imminent changes, but you'll hear if we do. And I see that Kate Fultalis, who runs the Los Angeles office of DMICE. Actually, probably with the pandemic now, we may have more remote people, but we're unfortunately unable to deliver the pizza to the Los Angeles office. Any other comments? If not, we also don't make people hang around if we're done for the hour, if we finish early. Let me just make a few comments to the new interns. One of you is actually working with me, Karen, and the others, I hope that we get to spend some time together. I suppose one of the downsides to our more virtual arrangement these days is that we won't be there in the room together just chatting. I also know that some of the new some of the attendees here are new clinical informatics fellows. So again, there's a relatively new training process for physicians, and so we have and physicians who become subspecialists usually do a subspecialty fellowship. OHSU, like many aspects of the field, has been in the lead on this. We were one of the first programs, and I know that I think the new fellows are also attending this session as well, and I know I'll be meeting with you all again virtually. Maybe this summer we can find ways. I actually have a pretty open and airy backyard, and as the rules change, maybe we can find some ways to get together in person. I also note in the chat, and I want to call out Chris Alpe, who's here. And Chris is our university librarian, so she heads the library, which is actually a tremendous resource. One of the complaints we get from graduating students is that they lose access to the library, and not so much the physical space, although they do lose that too if they're on campus, but the extensive holdings, almost, all of which these days are virtual, are online. We subscribe to, I don't know how many thousands of journals that, unfortunately you can't always get access to if you're not a student. So anyway, so for all the students and interns and everyone else, the library is a tremendous resource. And when the building opens up again, it's in our building, so you can walk into the building and access the library. And the library is not just the resources; it's the people as well. And a number of the library staff interact with our program. So thank you for bringing that up, Chris. And I see her waving there. I'm looking at, someone asked, what is my favorite? Well, I don't actually work in bioinformatics. I'm more kind of on the clinical health and clinical informatics side, but I don't know that there's a favorite project of all time. There are really important ones that have really transformed not only informatics, but the healthcare field. Certainly the Human Genome Project, if we're actually talking about bioinformatics, the original sequencing of the human genome, and of course now we can sequence a genome for $1,000, although it costs a lot more money to interpret it. There's other projects from the National Library of Medicine, PubMed, which is freely available, although again, sometimes you click to a journal article and you hit a paywall, which OHSU, if we subscribe to that journal, you can get around. Maybe the high-tech project of around 2009, 2010 that really ramped up the use of electronic health records. What other? Yeah, obviously there's all my individual projects, which are kind of favorites for me. I don't know that they're as impactful on the field, but I myself do work in search systems like PubMed and Google, but really more on the research side of those. I can't really compete with the National Library of Medicine or Google. And thank you to Chris for pointing out the projects in our archives. We do publish our theses and dissertations in the digital library that OHSU has. You can actually, our website connects you to our faculty. And so there are profiles or other kinds of web pages that they have, or you can search PubMed for them to find projects, things that faculty have done. I actually see that the interns have been introducing themselves too. I saw Palmer Bassett earlier, and Karen Garcia, who's working with me. I see Jalen Patel, who's working with Dr. Rybar. And I see another question from Gabriella. For someone that is uncertain about how they want to pursue science, how might this program provide clarity? That's a good question. And that is at least if I think I'm interpreting it right. How does one decide what they want to do with their career, or even how does one decide once they've decided they want to do informatics as a career, what area they might be focused in? The key thing is to expose yourself to the field. You know, we on the health and clinical informatics side, we actually have our introductory course that I teach myself because I really enjoy teaching that. Um, but you know, learning more about the field and what interests you, and these days, you know, I can remember a time, you know, for example, when I was finishing my medical training in the 1980s, and I told one of the faculty that I was going off to do, and I see Virginia there. I will get to you in a second. You know, I told the faculty, what are you going to do? You know, you're going to go into private practice. You're going to go do a subspecialty fellowship. I'm like, no, I'm going to go do this thing called informatics. And he's like, what's that? And then he made this comment, you know, so I said, well, it's working with computers. And his comment, which was um, weird back then, and certainly weird these days, was, well, you know, why do you want to use computers? Doctors should have all the knowledge in their head. And that was not true in the 1980s, and it's certainly not true at the present time. There is so much more information than any physician, nurse, or really anyone in any field can have in their brain. And so really the better approach to you know, bringing knowledge to doctors, you know, which is part of what my research focus is in informatics, is to really build them systems that help them quickly get to high quality information that they need. And there are different ways to do that, and some ways are better than others. And so even though I see a lot of doctors Googling things, and many Google searches do bring up very high quality information, but now with all of our fake news and all that other stuff, one needs to approach the internet with caution. And then another way, you know, for those of you who are in the program, Virginia Lankies, who is, I see her little cutout. You can wave, Virginia. She is our career development director. So she has over the years is like our #1 source of knowledge on the job market, because she scours the job ads. We actually have an email list for students in the program that is just a steady stream of job announcements. I post to that email list as well, because people also send job announcements to me. In fact, seeing the jobs that are out there is a way to learn more about the field, because you see what people are hiring people to do. You know, the best, hopefully the best outcome in life is that you have a job that is something you really enjoy. If you something you like to do and no one's willing to pay you to do it, then you obviously can't do that as a job. You know, if you can find a job, and I think many of us who do work in the field have jobs that we, for the most part, enjoy. As I commonly tell people, I like going to work almost all days. There are sometimes things with my job that I would prefer not to have to deal with, but I think that's true of any job. But I think most people who work in informatics are really really enjoy this kind of overlap of people, information, and technology related to health. So, Marie, currently in my class. That's great to hear, starting the HCIN program. And is pleased with our asynchronous delivery. You know, again, we were one of the first programs to start doing online learning. The technology was very different when we started. We offered my introductory course for the first time in 1999. And that was a time when most people connected to the internet by telephone modem. And so you couldn't have a lot of graphics, and you always worried that you're going to drop your connection. But we have learned a lot over the years. Another nice thing about our students is that they're very engaged, and they give us frank and honest feedback that help us improve the program. And I think you know, we've learned to do it well. We've found the things that students find important, and again, we were doing um, for example, some students like and still like, although it seems less, to interact in real time. So, we were using, actually before OHSU went to WebEx, we used to use Zoom, or some of the other ones before that. But being able to have virtual conferences. So our online students, from literally all over the world, then we have to deal with challenges of time zones. But we've been using those as well. Good. Okay, well, I'm not seeing any new comments. I actually appreciate those who typed into the chat. And again, I welcome the new interns and others who are newly starting the program. We do want to interact with you, even before the pandemic, but certainly during the pandemic, the best way to reach us is by email. We all spend time, probably too much time, on WebEx, but we're always happy to have a WebEx chat with you if you want to talk to us, one of the faculty or the staff. And I wish everyone well. And those who are starting in the program, I look forward to continuing to interact with you, probably in the immediate term virtually, but perhaps in real time. There are some students who I've actually interacted with quite a bit, but I've still actually never met in person. Okay, well, thank you, everyone, and have a great day and have a great holiday weekend, and we'll see you soon. Take care. Bye-bye.